Are you suffering from seasonal allergies but confused about which over-the-counter medicines to take? You're not alone. In this video, we're going to dive into the common over-the-counter allergy medications so you can make an informed decision about which one's best for you.
First, we're going to talk about nasal sprays. The two most common over-the-counter nasal sprays for allergies include corticosteroids and nasal decongestants. If your allergy symptoms are severe or persistent, you're actually going to want to start with a corticosteroid nasal spray rather than one of the oral antihistamine agents, which we'll talk about in a couple of minutes. And this is just because they're most effective at relieving your symptoms. So, your sneezing, your congestion, your bothersome eye symptoms, runny nose, to name a few. The over-the-counter products that we have include Flonase, which this is the generic. I always recommend the generic product if you're not partial to the brand. We've got Flonase Sensimus, which is actually a little bit different than the Flonase, and the benefit of it is it can be used in kids as young as 2. And it also comes out in kind of a mist rather than a spray, which some patients do prefer. Next up, we've got Nasacort. Again, this is just the generic. And then this is the generic Ranacort. So all of these options are really equally effective, and so you can choose any one of them. But one important thing to know about these is that it can take a little while to work. So while you might start seeing relief of your symptoms in just the first 30 minutes, it can take a few hours to a few days to start building up the best effect, and it can even take 2 weeks to 4 weeks before you get that maximum effect. So hang in there once you start it. Just know that it can take a while before they fully start working to relieve your symptoms. Another important thing to know about the nasal steroids is that they can cause some nasal irritation with prolonged use and sometimes even nosebleeds. So what you can do for that is just use a nasal saline spray, and this can help keep your nasal passages moist and help to prevent some of those issues. Last up, we've got your nasal decongestants. So the first one here is neosynephrine, and this is just the nasal form of phenylephrine, which we'll talk about in a little bit. Afrin is another option that can be really helpful. One important thing to know about this, though, is it cannot be used for more than 3 days because it can cause what's known as rebound congestion. And this actually means your congestion gets worse, which nobody wants that.
Next up are oral options. They are beneficial because they help with itchy or watery eyes and sneezing, and also runny nose, just to name a few. So let's dive right in and look at what's available. We have second generation antihistamines as well as first. The second generation antihistamines typically cause less drowsiness, so those can be more preferred amongst patients. So first we'll talk about Zyrtec. We also have it available in a store brand. Zyrtec tends to cause just a little bit more drowsiness amongst the second generation antihistamines. Next, we have Claritin. We also have Loratadine, so our store brand can help save you money. Next up, we have levocetirizine, also known as Zizal. And then we have Allegra and our store brand, Fexofenadine. What's neat about these options is they also come in a liquid form. Alavert comes in an orally disintegrating tablet, which is very neat because it will help patients that are unable to swallow tablets or simply do not prefer the taste or the volume of a liquid. And they are fast, so they start working within 15 to 30 minutes to give you relief. First generation antihistamines include Benadryl and chlortrimeton. So we also have a store brand in this one as well. These can cause a little bit more drowsiness and more frequent dosing. However, they are beneficial for allergy symptoms. Many of these products are available in combination with phenylephrine or pseudoephedrine to help combat nasal congestion, which can accompany allergies. And lastly, we have option from Darby Farms. This is an elderberry syrup meant to help boost your immune system, and fight off allergies and other illnesses.
All right. And last but not least, to treat your allergy symptoms this spring are the eye drops. So eye drops are very effective because they go to work quicker than tablets and usually last longer. So we've got products such as Pataday and Zaditor and generics for both of those. Those act as both mast cell stabilizers and antihistamines to relieve redness and itching of the eyes. We've got the good old Visine tablets, which work really well for the redness. It's got a decongestant antihistamine in it. However, you can't use that for more than 3 days, so you have to be careful with that one. And then last but not least, for people who want to stay with a more natural product, we have a homeopathic eye drop that relieves redness and itching associated with allergies. So we have all these available here at Table Rock Pharmacy. So if you'd like to come by, we'd be glad to talk with you about them. Thanks.
So you can find all of our allergy options here on this end cap, but feel free to come in and talk to one of our friendly staff here at Table Rock Pharmacy regarding any questions you may have with your over-the-counter medicine needs. And continue to follow us for more helpful hints.